This story has shaken many Nigerians, not just because of who is involved, but because of what it says about healthcare in Nigeria. Renowned Nigerian writer Chimamanda Ngozi Adichie has alleged that medical negligence led to the death of her 21-month-old son, Nkanu Nnamdi, at a private hospital in Lagos. According to her account, the family was in Lagos for Christmas when her son developed what initially appeared to be a mild cold. His condition, however, deteriorated quickly and he was admitted to Atlantis Hospital in Lagos State. Doctors there stabilized him and planned for him to be flown to the United States on January 7th, accompanied by specialists, traveling doctors. A medical team at Johns Hopkins Hospital in Baltimore was already on standby to receive him. Before the flight, doctors requested two procedures, a lumbar puncture and an MRI scan, as well as the insertion of a central line to help administer medication during travel. For these procedures, Atlantis Hospital referred the family to Eru Care Hospital, described to them as the best equipped facility for such work. On the morning of January 6th, the family arrived at Eru Care. Because Nkanu was a sick child and needed to remain still during the MRI, doctors said he had to be sedated. Chimamanda says she was waiting outside the theater when she noticed medical staff suddenly rushing in. Shortly after, she was told her son had given too much propofol, a powerful sedative, by the anesthesiologist. She was informed that he had become unresponsive and had to be resuscitated. From that moment, everything changed. The child, who had been stable earlier, was placed on a ventilator, intubated, and transferred to the ICU. He later suffered seizures, followed by cardiac arrest. Several hours later, 7-month-old Nkanu was pronounced dead. Adichie alleges that after the overdose, her son was not properly monitored and that critical medical protocols were ignored. She further claims the anesthesiologist carried the sedated child without proper support and later switched off his oxygen before transferring him to the ICU. She has described the actions as criminally negligent, stating that these events had never occurred before the procedure. Even more troubling, she says the family has since learned of two previous cases where the same anesthesiologist allegedly overdosed children, raising serious questions about hospital oversight and patient safety. The writer says she has been left devastated, calling the loss of her child a living nightmare, and insists that what happened must never be allowed to happen to another family. The hospital involved has not yet issued a detailed public response to the allegations, and no official findings have been released as of now. Beyond the personal tragedy, this case has reopened a national conversation about medical accountability, regulation of private hospitals, and patient safety in Nigeria. As Nigerians react with grief and anger, many are asking the same question. If this can happen to someone with access, influence, and international medical care, what hope is there for the average Nigerian?